Hello, and thank you for joining us for Inspire You. I'm Tina Cosby with Radio One and host of Community Connection on AM 1310 and 95.1 FM. We're going to be talking right now about the latest updates and answers to current flu and COVID questions with our guest, Dr. Bree Weaver. Dr. Weaver is the Chief of Internal Medicine at Eskenazi Health. Dr. Weaver, welcome to Inspire You. Thank you for being with us today.
Oh, thank you so much for having me.
Well, before we get started, can you share a little about yourself, who you are, what you do at Eskenazi, and anything else you'd like to share with us before we get going?
Sure. I am a native of Louisiana, but I've been in Indiana for a little over 20 years, where I came for my internal medicine and pediatric residency training, and then trained in infectious diseases, followed by joining the faculty at IU School of Medicine. My main site of practice is Eskenazi Health, where I see patients with infectious diseases, and I'm the Chief of Internal Medicine.
Well, where in Louisiana, might I ask, before we go?
How familiar are you with Louisiana?
Somewhat. I have some friends that are from there. They're not too far. I think there was one from Letcher.
Okay.
Letcher.
I'm from Ponchatoula.
Okay.
But for people that are not familiar, I say I'm from north of New Orleans.
Okay, north of New. So lovely territory. It's beautiful, and I love the food down there. We could talk food forever, but
I'd love that.
Yeah, we're going to talk COVID and flu this winter season. So where are we right now as we speak?
Yeah, so we're in the midst of respiratory virus season. So COVID and flu rates are on the rise. They're lower than they have been in previous years right at this point, but still higher than they were pre-pandemic. So still time for us to be vigilant and protect ourselves and others from these viruses. Hospitalizations are still occurring, especially in individuals over 70.
Yeah. So what's the status that you can give people in terms of where COVID-19, because as I was sharing a little bit before we went on, a number of people have mentioned to me and have said it, well, now that COVID's over, X, Y, and Z, and that is not the case. Can you explain and put that in context for us?
Sure. The COVID virus is changing and is still around. And I think we've just become a little used to it being around. So while the global emergency pandemic has kind of quieted down, the virus is still here, and it's still causing serious issues, including death and long COVID symptoms. So we've let our guard down a little bit, but the virus is still here. We're just a little more used to it. We still need to do things to protect ourselves.
Things like, do the pandemic guidelines still fit, like distancing, masking? I mean, how should those things be balanced right now?
I think a lot of it depends on how individuals are doing. So if someone is feeling ill or someone around them is ill, it's important to stay away from them. Hand washing will never go out of style. So washing your hands, especially if you're traveling or in places where lots of other people are. You can wear masks to help protect yourself and others, especially if you're immunocompromised. Mm-hmm. But I think we're just trying to incorporate all of those things in with regular life. We're not staying away from each other every day. And I don't think we need to. I think we just need to pay attention to when we're feeling ill and if others are feeling ill around us.
What about distancing? And, especially this time of year, people are shopping, more people are out shopping. I know I was out the other day, and there was a gentleman that was almost breathing over my shoulder, it felt like. And the more I was getting away, trying to create some distance, the closer he got, I guess, trying to scoot up in the line. What about distancing? Was I overreacting, or we still need to maintain reasonable?
Yeah, I don't think it's an overreaction. I think each individual is going to have a different comfort level with being close to others. You can always wear a mask if you're thinking that you might not be able to. I
Hmm.
hope that people can respectfully ask others, hey, can I have a little space here?
Right, right.
That would be nice for everyone, because you don't know what the person next to you may be experiencing. They may have some immunocompromising condition. They may be getting chemotherapy. They may have something that would put them at even higher risk if they were to
Mhm.
get one of these respiratory viruses.
So where are we now compared to where we were a year ago, as far as COVID is concerned?
I think we're in better shape, I think, than we were maybe a year to 2 years ago. So a year ago, the respiratory virus season was tough for everyone, but we have excellent vaccines and more treatment options for people than we had before. Plus, for the first time in history, we have three vaccines for the three major viruses that we encounter during the winter: COVID, influenza, and RSV, or respiratory syncytial virus. So I think we're in better shape this year from a respiratory virus um, perspective.
So we've been hearing a lot about COVID and the flu and the shots that you can take together, and then but we've
Mhm.
also been hearing a lot about an emergence of RSV. Why is that? Is that
Mhm.
more prevalent now than it was a year ago? I mean, what's going on with RSV? Because we keep getting the warnings.
Mhm. So the patterns of respiratory viruses kind of changed with our changes in behavior. So
Ah,
the people isolating more made the rates of those types of
I see.
viruses low. And then as we're not isolating and not masking, RSV has made a resurgence. It typically affects babies and children, but it can also cause severe illness in older adults. So it's it's seemingly more prevalent now, but it's partly because we weren't seeing it
Ah,
as much when people were isolating more.
yeah, that makes sense.
Yeah.
The commercials that say you can do two things at once. You can take your flu shot and your COVID shot at the same time. What's your direction on that, or your recommendation?
Absolutely. Please get
Really?
the vaccines. You can absolutely get them both at the same time. They will be as effective, and there is actually some studies that are showing that they're more effective if you get them together.
Really?
Mhm.
Okay.
Generate higher antibody levels. Yeah.
So
Mhm.
what's the timeline for? I know when we were in the emergency status, emergency phase with COVID and the vaccines, we got very clear, repetitive timelines that were
Yeah.
repeated to us. I haven't heard a whole lot about what the current timeline is for that. Is it just now one vaccine for the
Mhm.
remainder of the year, like a flu shot, or is it a vaccine and a booster? Or
Mhm.
how is that working now compared to how it was last year and the year before?
Yeah. Yeah, that's a great question, because it did seem to be very confusing. I think it's become simpler now. The guidance now from the CDC is that everyone 6 months or older should get an updated booster. So that's the bivalent booster, and there are currently three available by three different companies. Pfizer and Moderna both have mRNA vaccines, and Novavax has a protein subunit vaccine for those individuals who aren't comfortable or don't want to get the mRNA vaccine.
Yeah.
The latter one that I mentioned is approved for children 12 and older, but the
Mhm.
other ones can be given down to 6 months. So the recommendation is everyone should get an updated booster no matter what they've received before. Even if they were unvaccinated or partially vaccinated, they should still get the updated booster. And the only difference there is if you get the Novavax, you get two shots if you're previously unvaccinated.
I see. So what's the difference between a booster and just a vaccination? Because with the flu shot, you just get the flu shot.
Right.
And with COVID, we're calling these boosters, but do they have to, I don't understand the difference in terminology, I guess.
Yeah, I think that landscape is changing. So as we're probably going to move towards more yearly vaccines, we're probably not going to call them boosters anymore. But we called them boosters because they were augmenting responses that we had to
Ah.
previous vaccines. I think that terminology may actually change. Yeah.
So should you get, like, if you had Pfizer or Moderna
Mhm.
and you're ready for, how long after your last booster should you go ahead and schedule your new booster?
There are various recommendations in the 4 to 8 week period. I think it
Uh-huh.
depends on specifics about the vaccine.
Yeah. Okay. And then how long have the recommendations changed regarding, if you've had COVID, you need to wait 30, 60, 90 days before getting a booster or a vaccine again? What's the guideline on that, and has that changed?
The guideline currently is that you should have resolved your illness. So you should feel better to go get your booster. You don't have to wait a certain number of calendar days. You should just feel better because you may expect to feel worse after a vaccine as your immune system starts to respond to that vaccine.
So the 90-day guideline, no?
Mm-mm. No, just have to feel better.
Huh. That's interesting. Okay, that's new news. Okay, so the in terms of who should get the booster, as far as COVID, and who should not, I don't know. What age? What are the age ranges again? I think you mentioned it a
Yeah,
few minutes ago, but I want to repeat that so that people get it and
yeah,
understand.
yeah. It's nice because it's a simple one-liner. Everyone 6 months and older should get an updated booster. So everyone.
And again, if you've been getting Pfizer boosters, you should stay with that. If you've been getting Moderna boosters, you should stay with that, or you can use them interchangeably.
So you can use them interchangeably. The
Mhm.
official CDC recommendation is that you should try to use the same product. However, they give some situations in which you may want to use a product from a different manufacturer, and
Mhm.
those include if the same manufacturer is not available or if you don't know what your previous manufacturer is. And one of them that stands out the most to me is that if the person would otherwise not get vaccinated, then you can interchange them. So it's very clear that they're able to be interchanged. If you can get the same one, that's great. You know you've already tolerated that one well, but you shouldn't stay unvaccinated or you shouldn't stay unboosted just because you can't get the same one you had before.
So after you get your booster, for whatever, and then and say, for instance, you want to travel, or how long before it becomes fully, I guess, full effect, gives you the maximum benefit of the injection?
Yeah, that's a great question. So vaccines don't work overnight, and we typically think that a 14-day period is the time when most people will have responded and made antibodies. So if you can get vaccinated pre-travel, give yourself a couple of weeks.
So if you're traveling, say mid-December, you should get your vaccination or booster right now.
Absolutely.
Okay.
Absolutely.
Yeah.
Because there's virus in the community as well. So you need to protect yourself as soon as you can. Even if you're not traveling, you should get your vaccines now.
Speaking of community, how's our community doing in terms of percentage of the community that is now vaccinated? I know we tracked all of these numbers pretty closely the
Yeah.
last couple of years. They haven't really brought it to the forefront so much lately. Where are we there in terms of the percentages of our population here, local community, that is now vaccinated?
Yeah, I don't have the absolute numbers in front of
Mhm.
me, but the last time I reviewed, we still have a long way to go to get people vaccinated. The highest vaccine rates are in the tiers of older individuals, so 70 and older, 65 and
Mhm.
older, 60 and older, and those numbers go down as the age range goes down. So I know that nationwide, we're at around 80% for people who have gotten any vaccine, but
Mhm.
only about 17% for people who have gotten their booster. And the booster is the most up-to-date version that protects against the variants that we have been seeing
Mhm.
lately. it doesn't really address the old variants because we're not seeing them as much anymore.
So other than the brand name, when you go to get your booster, other than the brand name of the booster, do you have to ask for a specific one? Like, do you have to say, "Hey, give me the latest one," or isn't it automatic?
It should be an automatic, but the place that you go will probably want to know your vaccination history and make sure that they're giving you the appropriate vaccine.
Yeah.
But saying I want the latest shot, the most updated shot is the best way to make sure you get what you need.
I know you said you didn't have the numbers, but I wanted to circle back a little. We can talk in generalities. You said the most vaccinated population, are 70 and over, correct? I think, is that what you said?
Or the older. Mm-hmm.
Are older.
Yeah.
And if we drill down a little, I remember that we were sending out urgent messages the last couple of years to minority communities, specifically African American community, because in terms of demographics, that was the lowest rate of vaccination. That demo was the lowest rate of vaccination. Have you noticed the last time you looked any improvement in that area in terms of African Americans? I know in terms of Hispanic and Latino populations, those have greatly improved, according to Dr. Kane and some of the others who spoke not too long ago. The African American population.
Yeah, I believe that has also, the vaccination rates have also improved, and in part by people in the community advocating for their fellow community members. So I think that those rates have gone up.
Yeah.
But in general, we still have a long way to go. There's still a lot of people that aren't vaccinated.
So if we all, right after looking at this Inspire You wonderful video, if we all go and get boosted right now, when would we be due for a booster again? A year from now?
That's not clear yet. We don't have guidance from the CDC or the Immunization Practices Committee. I think that that's where we're going, but we don't have anything official yet.
Okay, so let's circle back then to the flu vaccine.
Yeah.
If we get the flu shot now, are we good until this time next year with the flu shot?
That's what, yes. We know that the virus is circulating most during the winter time, and we just don't see it in the community during the summer. So the immunity that we generate now will last us through the flu season.
Through the flu season. And the flu season is basically the same as the COVID season, right?
Basically, right? It's the winter months that we have seen some flu back in September start to emerge, and then usually we don't see as much when we get into March. So the fall winter time.
Yeah. So again, other than the vaccines, which are important and crucial, what is it that we can do? Especially, I know we talked about this, and I'm sorry if I'm being repetitive, but especially as we're heading into the holidays, you can say more people are inside, folks are gathering in large groups for dinners, parties, and things of that nature. What is, other than the vaccinations, and we'll get back to those in just a moment, but what can we as individuals continue to do to be diligent and make sure that we're all keeping each other safe?
Yeah. We can, as hard as it might be, we can stay away from our friends and family when we're feeling ill. It's really hard to do during the holidays because you want to see your grandparents or your nieces and nephews, but staying home when you're ill, wearing a mask, and washing your hands. I can't tell you how important it is to make sure that we're keeping our hands clean as we touch the little kids and then touch our own face, or vice versa.
Yeah. And your guidance regarding air, train, and bus travel, which picks up around this time of year as well. Your best guidance for us if we're doing that.
Yeah, I think all of those still apply for travel. You know, it's just like being in a living room with a bunch of people for a few hours. So you're going to be closer to people, and you're going to be not have as much ability to move away if you're on a plane next to someone else. So making sure you keep your hands clean, wearing a mask is a good idea. And then if you can, don't travel when you're ill.
And any thoughts on the fact that the mask mandate has been lifted on public transportation? I'm never comfortable I wouldn't be comfortable it's going to take a long time before I don't wear a mask on a train or a plane.
Mhm.
Any thoughts on that?
Yeah, I don't love that a lot of this science has become politicized, but I think that what the place we are now is that people can wear a mask on public
Yes.
transportation and not really be, no one will bat an eye. No one thinks it's odd that someone wants to wear a mask. So even though it's not mandatory, I think people can make their own personal decisions about what they think is right for them and the people around them.
In tracking the COVID, are there new variants that I don't know are behaving in a way that we need to be concerned about, or are we pretty well contained in managing what we have right now?
Yeah, so variants are going to keep coming up. We're going to keep seeing variants. Viruses mutate at variable speeds, and so each time that happens, the virus is a little bit different, and it becomes what we call a new variant. Some of them are very closely related. Some of them are very different, and we're vigilant to see if those mutations make the virus behave differently. And as we right now, the virus is still doing all the same things that it used to do. It causes fever and upper respiratory symptoms, aches, and it can still cause very serious illness and hospitalization.
Yeah, and we don't want to overlook the flu,
Right.
in terms of having a COVID conversation, because the influenza is still quite serious.
Yes, it's quite serious. They estimated that there were around 5,000 influenza deaths in the 2021 to 2022 season. So it's still causing lots of hospitalizations and death. And with 2 and 3 and more viruses circulating at the same time, as much as we can do to protect ourselves from severe illness from any one of those, um, that's the best thing for us. You can get more than one at a time. So
Yeah.
you can have both COVID and flu at the same time and have augmented effects from both of those.
And that was my question, Dr. Weaver. How do you know? How can you tell the difference between the flu and COVID? And I mean, you kind of answered the question a little, but if you're
Yeah.
coming down with something, is there a symptom that definitively says this is COVID and this is the flu, or is it a situation where the only way you're going to know is to take a test?
Yeah. The symptoms are so similar that you wouldn't really know unless you took a test. The one thing that has stood out in the past and is still occurring with COVID is the loss of your sense of taste and smell.
Yeah.
That still stands out, but it doesn't happen for everyone. So you can't use the fact that you can still taste your coffee as a way to say that you don't have COVID. So you'd have to be tested.
But you know what? I got to thinking about it though, and when I've had a head cold or whatever, I can't smell anything either, and I've not had COVID. So that
Yeah.
even that one kind of crosses the bound. I mean, that kind of crosses over too, doesn't it?
Yeah,
Not
I
the
think
taste, but the smell.
Yeah, that symptom in people who have had that effect from COVID tends to last longer. When we
Ah,
when we start to clear our nasal passages and we can smell again,
uh-huh.
it's also connected to taste. So then we can taste and smell again. But some individuals who have lost that sense have still not been able to taste things properly for months.
Wow. Is that considered long COVID?
It's one of the symptoms of long COVID. Long COVID is um, very abstract and still being defined, all of the things that can be related to the inflammatory response to the virus. And
Mm.
lots of research now is actually focused on diagnosing and the best therapies for long COVID.
Yeah, I have a friend, and she says her smell and taste, they're faint, but they've never been the same since
Mhm.
she
Yeah.
had COVID. And she had COVID in December of 2022, I think.
Almost a year then.
Almost a year. And I mean,
Yeah.
she has some functionality there, but she says it's not the same. So you just wait, or what do you do?
Right now, you just wait. That's what the medical and scientific community are hoping to be able to address with the studies that they're doing now. How to either prevent those things or to treat once they've happened. But right now, you wait.
Is there any indicator in terms of who might be most likely to contract long COVID as opposed to a regular COVID cycle, I guess, or is it hard to predict who will be impacted by it?
It's very hard to predict. Specifically, the severity of your case of COVID doesn't predict if you'll have long COVID symptoms. That's it takes us back to vaccination. So the more we can even prevent having COVID, then the better off we are, because you can still have long COVID symptoms with very mild cases.
Wow.
Mhm.
So again, the reasoning behind the vaccinations, again, I guess we can't state it enough. It's and sometimes and a lot of times people have said, well, I had the vaccine and I still caught COVID. That's not the point. The point, Dr. Weaver, is
Yeah. The point is to prevent severe disease and hospitalizations. And I should probably go back on what I just said. The vaccine will not prevent you from getting COVID,
right.
but it's the safest and most effective way to prevent you from having severe illness at the time, or being hospitalized with COVID. I think the toolbox for COVID is vaccination to prevent the severe illness and all of the other things to prevent transmitting the virus or catching the virus, the hand washing and the staying away when you're sick. Those will prevent you from getting the virus at all.
First line of defense, definitely the vaccinations.
Mhm.
Yeah.
Yeah.
And the availability of these vaccinations and vaccines is still everywhere, correct?
Pretty much everywhere. Yeah. Any neighborhood pharmacy, your primary care providers, hospitals, they have the vaccine.
Yeah. And finally, there are those who say, I don't take the flu shot because it gives me the flu, or I'm not going to take the COVID shot because it makes me sick. Can you help us out with that?
Yeah, sure. The flu vaccine does not contain, and the COVID vaccines, they don't contain any live virus that could give you the flu or COVID. So the nasal spray flu vaccine contains an inactivated virus, but it's too weak to cause the flu. And what people sometimes think is the flu itself is the immune system responding to the vaccine and cranking out the antibodies that you need to protect you from severe illness. So you can't actually catch the flu from the flu vaccine, but you may feel bad. You may feel terrible after your vaccine, and that's ultimately a good sign that your body's responding to the vaccination itself.
And same with the COVID vaccine. You may feel.
Personally, I felt terrible after my most recent COVID booster.
Oh, really?
I felt bad. Yeah, but I'm really glad I got it.
How long did your symptoms last?
A day.
A day. Yeah, the same with me. It was one in the cycle. I just felt a little bit of a headache and went to sleep, and it was gone the next day. So. Yeah, and it can be easily managed with some Tylenol or ibuprofen if it gets. Like my father, his symptoms are always he has the sorest of sore arms for whatever reason. He always reacts to the arm and takes the Tylenol, and he says that goes away too. So some people have no symptoms.
Right. Some people see lymph node swelling in their armpit, or in the armpit where they got the shot. It's all part of the immune response, and it will get better.
So, Dr. Weaver, as we wrap up here, again, if you could just kind of summarize with your best advice, your best guidance, and best information for those who may be watching, how would you summarize everything as we head deeper into the cold and flu season, and what we can all do to help ourselves?
Yeah, I will say we are in it. We're in the cold and flu season. We are seeing rising rates as people spend time together. And the things that we learned about in the pandemic, hand washing, masking, staying away when you're sick, and vaccination are all still applicable today. So doing those things will be good for you individually and good for the people around you.
Absolutely. Dr. Weaver, thank you so very much.
Thank you, Tina.
And enjoy the rest of the season. May you stay healthy.
You too. Thank you for having me.
Thank you. I'll do my best.
Everyday life is busy enough without worrying about viruses. But just because you're ignoring flu and COVID doesn't mean they'll ignore you. Right now, Eskenazi Health Center is protecting everyone from 6-month-olds to seniors with safe, updated vaccines that can help keep your family from missing school, missing work, or missing good times. Visit eskenazihealth.edu/vaccines and see how a shot in the arm can take a load off your mind.